welcome to the School of Speech podcast, presented by SpeechTherapyPD.com. School of Speech is designed specifically for the school-based SLP to come together to discuss current topics, tackle difficult situations, and share our insights. Our goal is to bolster confidence, celebrate our triumphs, and foster a community dedicated to the excellence in the school setting. Hi, everyone. I am Carolyn Dolby, and I am your SpeechTherapyPD.com podcast host for School of Speech, which has been designed for school-based speech pathologists to come together. We're going to tackle some tough topics, celebrate our triumphs, and foster a community dedicated to excellence in the school setting. Well, today's episode is exploring dynamic roles and ethical boundaries with my special guest, Lisa Gore. All right, we are so glad you are joining us for this exhilarating journey of the school-based speech pathologist. But before we get started, I do have some housekeeping we need to settle. Each of these episodes will be 60 minutes and will be offered for 0.01 ASHA CEUs. All right, let me get into some of our financial disclosures and non-financial. I'm going to start with Lisa Gore. Lisa receives financial compensation for contract work from numerous school districts. She has a private practice called Radar Speaks, and she also receives a salary from Texas Tech University Health Science Center. Lisa is also receiving an honorarium from SpeechTherapyPD.com for today's non-financial. Lisa is the vice chair for the protection and advocacy for individuals with mental illness, the chair for Health and Human Services Policy Council for Children and Families, and she chairs the TISHA Feeding and Swallowing in the Schools Task Force, along with being a committee member for ASHA Special Interest Group 16 School-Based Issues, along with being an ASHA mentor. Lisa, you're truly amazing. I receive a salary from Cy-Fair Independent School District as their dysphagia support clinician. I am compensated for my graduate courses that I teach at the University of Houston. I am a consultant for school districts across the nation, supporting their program development and staff training. And I am also receiving compensation from SpeechTherapyPD.com as host today. Non-financial, I'm a member of Texas Speech and Hearing Feeding and Swallowing Task Force, where I met Lisa. I'm a volunteer for Feeding Matters, and I'm a member of ASHA Special Interest Group 13, which is swallowing and swallowing disorders, as well as SIG-16 school-based issues. So now, without any further ado, I want to welcome our guest, Lisa Gore. Lisa has provided services across multiple settings. She has over 30 years of experience in the schools, serving ages 3 to 21 as the lead speech pathologist. Amazing. She has been a provider of services for the deaf and hard of hearing, as well as a certified autism specialist. She provides training for school districts on multiple topics. She has worked in skilled nursing, inpatient, outpatient therapy settings, and in home health. And currently, she is the clinical instructor at Texas Tech University Health Science Centers, as well as supporting multiple school districts through her private practice, Radar Speaks. Lisa has also been selected for multiple awards at the collegiate level as an educator and clinical instructor. Welcome, Lisa. We are so happy and excited to have you here. I am seeing hi to everyone. I'm seeing all over the place. We're so excited to have so many people joining us today. Hey, Lisa, are you ready?
I'm ready.
All right. All right. Let's jump in. How are you?
I'm wonderful. How about you?
I am great. I am so thankful that you're here with us today. We have so many fun things to talk about and the stuff that you have to share with us is so today and stuff that we really need to hear. So we are so excited. Do you want to start with maybe walking us through the role of a school-based clinician?
Okay, I'll be happy to. Okay, I'm seeing that we've got some people across the nation. So I've had experience in Texas and New Mexico. So oftentimes our licensure is a little bit different across states, but we are all bound by ASHA's Code of Ethics and scope of practice within ASHA. So talking about a school-based speech pathologist, I think we need to consider how much our scope of practice has actually grown over the years. I remember I have 30 years experience, someone older one. So I have seen just so much added to our plate, which I know is sometimes a challenge for those individuals that are providing services in the school, because nobody's taking anything away. They're just adding things to our scope of practice within the schools. And one of the things I tell my students all the time is that, you are a speech language pathologist. You are a medical professional, a licensed medical professional. And it doesn't matter if you're in the schools or outpatient or inpatient or skilled nursing facility, you fit that role and you're bound by your licensure of the state. You're also bound by ASHA's requirements. And sometimes I think that gets convoluted in our school setting in that, well, I'm a school-based, no, you're not. You're a licensed medical professional, no matter your placement and what is required of you in that particular setting, you're first and foremost an SLP. And so as we go through this process, we're going to talk about that scope specific to the schools. It's not that different from other places any longer. At one time it was, absolutely. But now, we're responsible for, and of course, Carol and I, this is how we met and became friends, was when we were talking about feeding and swallowing in the schools and those requirements that are, we are ethically and legally bound to provide those services. And so that's new for some of our, especially older providers, and even some of our new ones that maybe didn't get a real good footing in that particular thing. And I will say, from my years of experience of working in multiple settings, I've had the most experience with the most unusual cases in the school, way beyond home health, way beyond inpatient and outpatient. I have seen some syndromes I didn't know existed in that school setting. So our scope is massive. The expectations are massive, and the workload is huge. So knowing that information, we've got to also protect ourselves and our mental health. So scope is huge.
Right. I was reading, there was an article that I read. It was, I think his last name, it's William Mustaine, I think. And he is saying exactly what you're saying, that our scope has broadened on a regular basis, and it's encompassed an ever expanding knowledge base, resulting in advances in evaluations and treatment techniques, right? I mean, that's exactly what we're up against, and we need to keep up with the times, right? Oh, I'm seeing school setting people. We've got Emily from teletherapy for schools. We've got someone from private practice. Thank you for joining us. This is great.
Yes. Well, also one of the things that I want us to always remember as we go back to this, because you touched on this, Carolyn, and I think it's something that we have to really keep in our mind. We're ethically bound to keep up with our training. And so if we're not trained appropriately, then it's to us to get the training that we specifically need. I know in a minute we're going to talk about scope of practice versus scope of competence. And I think as school professionals, we're kind of like, here, speech will take it. Let's refer, well, I don't, speech will do it. Well, there's also a workload expectation that is beyond what is appropriate for appropriate service delivery. So I think we, as speech pathologists in the schools, really have to keep that in mind as we provide appropriate, ethically, evidence-based practice in the school setting.
Absolutely. I think when we're looking at, you kind of touched on two things that made me think about when we're talking about, yes, we are speech pathologists, all of us, but those of us that are working in the school setting, it's not that we can't do everything, but we have to think about what is the setting that we are in, and what is our purpose being speech pathologists in the school setting.
Right.
Yeah.
Right. Talking about educational impact, but educational impact, and I know I'm speaking to the choir here, is not just about academics, about functional performance. So I'll go back to what we talk a lot about, Carolyn, is that, we got to make sure kids have adequate nutrition and hydration. Well, just when you first hear that, well, how is that an academic? Well, if I'm hungry or if I don't have enough hydration, that does impact my functional performance and sometimes my academic performance. So we really have to look at the whole child to support that kid within the school setting.
Right. And I know that we are bound by our eligibilities, that they have to have an eligibility in, one of the, and then they need to be, it needs to affect their, you're saying not only academic, but also their performance, their functioning. And then the services are needed to be provided by a specialist, which would be us. Yeah.
Right.
Yeah, exactly. We've been talking in my district a lot about those impact statements. That is so strong to really show we are proving that there is an adverse effect and our services are needed. So I think that's super important. Thanks.
Can I go back to the point about the scope of competency? Can we talk about that? Okay, this is something that I think that we really need to make maybe administrators aware of, and those that are above us. We have lots of bosses in the school setting. We have an assistant principal, a principal, a special ed director, a lead speech pathologist. There are so many people that are part of this entity for the service of the child. One, always the student comes first. We've got to look at that student first, but we don't have to know it all. And I think oftentimes, we are fixers, we are interveners, we're empathetic, we have all these wonderful skills, but no is not really something we're good at. And it's okay to look at our scope of competency. That's what we're competent in. Maybe it's our specialization, maybe it's our experience base, but that's our scope of competency. We do not have to have scope of competency or skill in all areas. I'll be honest, fluency is not a strength for me. It is not a strength for me. If I'm going to, and I've probably had 3 over my 30-year career, I just don't have a lot of fluency cases. And so I know about this much. Well, that's okay because it's on me to find out. And if I am not competent, then it's on me to find someone that is. And I know sometimes that's difficult. I live in rural West Texas, and I may be the only provider for, I'm not even teasing, 300 miles. And so if I don't have fluency competency, it behooves me ethically to do the research so that I'm providing evidence-based practice, or to seek out that expert, call those people in to help support me for that student's benefit. So realizing that you do not have to meet the whole our scope. You just have to find out how to make competency for that particular student and their needs.
Right. I think we are like Superman of speech, but I heard something. It was knowing what you don't know is really the cornerstone of your professional maturity. It is okay to be able to say, you know what, I don't know, but it's not okay to say, I don't know, so I'm not going to do it. It's no, I do. Maybe you don't say, no, I don't know that, but you're going to say, hey, I need to do a little bit more research and reach out. We're in 2 totally different communities. You're in rural Texas. I am in huge Houston. The one thing I really love is when I have a question. I know when I was moving from an elementary based to secondary, I just shot out an email to all the secondary speech paths and said, I need your knowledge. I love Felice added to what you were saying. She goes, no, we need to know where to look. We need to know where to look for our competence. Besides, we can look at journals, we can look at webinars. There's a lot of things out there. We just have to start looking and asking. I get random emails from people asking me questions about dysphagia in the schools because that's my jam. I answer them. I mean, I welcome it. So I really think that is part of our scope of practice is actually that mentor part. And I think we all need to remember that and be willing to do that. So important.
And sometimes it's difficult for sure.
Oh, yeah.
To step up and take that on. But really that's part of our ethical bound is that we are to train those coming up. So, helping support those people. And one of the things I think as speech language pathologists that we maybe need some support in is we all those roles again. We're counselors, we're actors, because, you got to make therapy fun. But we also need to be advocates for our students and ourselves. And so sometimes it's okay to say, hey, I need some help here, administrator. I don't feel comfortable with this. Let's reach out. And sometimes that's a hard conversation to say, but you're exactly right. Knowing what you don't know is critical. and then where to find that stuff. One of the things that's nice, it sounds like I'm giving a commercial, but you guys are here tonight. So you're seeking out that competency by attending podcasts, doing these trainings on speechpathologypd.com. I mean, you're in that role, but making that connection, going to your state's convention, being part of organizations, reaching out to others, because that's how we learn from others, being part of that community and supporting one another.
Absolutely. I want to, Lisa, go back a little bit more, because let's talk about the role. Because when we were talking the other day, I loved what you were talking about when the role, the surface role speech paths through the different levels of public school. I want you to, I mean, that just.
Okay. All right. So, and I'm going to talk specifically from Texas. I don't know how it is in other states, but we really kind of take over at age 3, unless those individuals are deaf or deafblind. Then it's 0. In utero almost, but not. So our role, I'm going to call the elephant out in the room. Previously, there was kind of this thought process of, the kids hit middle school. Do they really need speech anymore? That kind of thing. That's a kind of old school thought, but I know it's still around because I hear it in school districts all the time. Well, language continues your whole life. And what we've got to do is we've got to get out of that mindset of we've got to pull a kid out and see them for services. We've got to look at collaboration. We've got to look at consultation. We've got to look at direct services, indirect services, supports for parents. We've got to look, I know our scope is huge, but it doesn't mean that we have to do old school speech therapy where we pull out and do that sort of thing. And I was telling Carolyn, and I try to teach anybody I talk to, as soon as you get an eligibility criteria or a diagnosis, depending on your placement, you need to start thinking about community involvement and employability. I don't care if they're 3 years old. So when I get a 3-year-old eligibility for autism, I've got to start thinking, because you guys, our lifespan is huge, but in our opportunity to work within the schools is, maybe 15 years if they go beyond, your typical graduation. And we got to get every kind of education in prior to that, because at 18, 20, 21, 22, that's it. That's the mandatory education. So we got to start really planning at a very young age how to get these individuals with some sort of disability ready for community involvement and employment. Because I can tell you, that's what parents want.
Right.
That's what they want. And that's what our kids need. We've got to start thinking beyond the school doors.
I think as you think about starting at 3, it's really talking with those parents. Talking with their parents. What are their expectations? Depending on what the student's eligibility or diagnosis is, what resources are out there right now that they need to be thinking about for when their child is 18? Because it's very hard when you've got a 3-year-old to think about what are they going to need when they're 18. Yeah, starting there.
Yeah, that consultation and collaboration and education is a very critical piece of our puzzle. And I think we forget that. And I know a lot of it's we're busy. We're just thinking. But if we look at it from a different lens, we can reduce our direct services and support even more appropriately with consultation and collaboration. You guys know this. We see kids for such a limited amount of time. The teachers see them a lot during the day. And if we can impact that teacher to impact language and communication, or feeding or swallowing, or behavior, because our scopes were blown up to behavior, right? Then we're making an all-day impact, not our 20-minute session 2 times a week. So thinking outside that box is always beneficial to us, and also to the student, the family, and the educators.
Yeah, Carrie is saying, yes, it's a lot of exposure and repetition of language when they're in a language-rich classroom. So yeah, we need to get in on that. Absolutely. Thanks.
Early. We all know that early intervention is the key. I'm an assessor for autism. That's my jam. And there's no reason if we're not doing the education we need, I shouldn't be assessing an individual for autism in the 5th grade. Somebody somewhere didn't get somebody ready to look for, some of those characteristics that we could, because we've lost all those years of intervention. So now our time is much shorter to get what that person needs for community involvement and employment.
When you're doing you said early childhood, the ECSE is what we would call it, evaluations. Mm-hmm. Do you have any tips on how you kind of address that when you're seeing something more than maybe the parents were thinking was there?
Well, that's a hard question.
I know.
That goes back to education. And you guide, oftentimes you facilitate the parent coming to the table of understanding. Maybe it's more than just articulation. And that's those interview skills that we naturally have about, okay, tell me about, their activities on the playground. Tell me about their friends. And you guide the conversation. Now, we all know that there's a grieving process for parents and bringing them in. It may not be at the first meeting. You may have to stretch that. And we're going to talk in a minute about functioning at the top of your license. But one of the things that we've got to do is we've got to do a lot of education, and we've got to educate those educators to help give information to the parents. We do no favors to parents or students to candy coat information. And I see that all the time. Well, he's just so smart, but yet we've done assessment that says he's intellectually disabled. Okay, that child we've done a disservice, and I'm all about kindness, but we've done a disservice because in Texas specifically, there are waiver programs that are 12 and 13 years wait. At 3, those kids need to be put on those lists for their services they may or may not need later, but if they're not on the list, they don't have that opportunity, which is another thing within our scope, understanding the resources in your community and in your environment.
Who could someone in another district, who should they be reaching out to get those resources for parents?
Oh, that's a hard one. Every state is very different, but you need to be aware of funding sources. And that is a lot of times going to the website to look for what's out there for our families that are faced with poverty, that are having to access those things. In some states, they have resource centers where you can actually say, tell me what's out there. In Texas, they're called regional centers, and you can say, I need to know what's out there for intellectually disabled students. What is out there? And of course, I'm calling it again, but every state has a workforce commission. It's a national mandate. There's national mandates out there that we need to become aware of. And sometimes it's what's in California to support kids. It's a Google. What's out there, and then I have just a list. I have just a list of things that I can talk to parents about specifically, and we know that having a child with a disability is rough. These parents also need to be aware of support systems for them and who they can reach out to for their support, and who do they go to, because we live this, we talk it every day, we understand the vocabulary, we understand the verbiage. The parents do not. And knowing how to support the parent through the process is as valuable as intervention.
Especially in this age of technology and social media, would you also suggest parents maybe getting onto social media, Facebook groups and things like that, support groups, find their people, find their community?
Finding those social groups.
Kind of like how we would find a mentor that's kind of already, that has the competence, going out and finding a community. So with somebody that's maybe a little further along in the journey, that can kind of help them, kind of ease them in, help them understand, kind of sometimes that education language that we use. Yeah, I think that would be really important.
One thing I want to say that I didn't mention earlier that I think that we need to start doing is this is from Lisa, nobody else, okay? I think we start giving ourselves credit for what we do. And so oftentimes we need to do parent education, but that is a related service. And we don't put that into our documents, and it takes a lot of time. If I'm going to do a training for parents about what is autism, what is the expectation, that kind of thing, that needs to be documented in that we're providing those services. In Texas, it's required with an autism supplement, but also it's required for us, for people to realize, working at the top of our license, we are the trainer of trainers. but we need to give ourselves credit in the school setting that, I am going to support this student not only by pull out 20 minutes every 2 weeks, but also by integrating the parent into some education, sending out, information, that kind of thing. That is all related services in schools. And we don't give ourselves credit for that. And I think we need to start doing that. One, I think it helps support us in our workload expectations, but also can't tell you how many times, oh, you do more than R? Oh,
Right.
you do,
Right.
y'all get that too. No, you do. Where it's like, you do that, you can help with figuring out if they have memory issues. It's just crazy because, and that's on us. We don't educate very well, but that's something that we need to consider as we go through. Okay, who could best service this child by doing some of that other stuff?
Mm-hmm. You kind of, before we get in, I know you're going to get right into the top of the license, but I wanted to back up a little bit and talk about service deliveries. There are different ways for that to look. I think you hit on something super important, and that is the part that you do need to have that indirect time that you can set aside, because your time is valuable. You need to, that time that you are spending with the parent, that is invaluable time, whether that's on the phone or doing those emails, that needs to be put into your workload. Felice, she says, helping getting buy-in. Yes, by implementing collaborative services. Absolutely. Right. Absolutely.
And I will say, I think push in sometimes is harder, but it's a time issue, that collaboration time. But you can imagine the positive feedback, because teachers don't know what we do. And you'll get the, wow, I didn't realize that you could do that. You really helped me with my reading lesson this week, or that vocabulary I didn't even think about. That math vocabulary is important. If they don't know what the words are. And so there's lots of things that we're doing that we're not giving ourselves credit for. And so, Carolyn, this is my suggestion. You need to be putting some of that stuff in that indirect services. And indirect services does not necessarily have to be specifically for the parent. Some of those indirect services are that collaboration piece, time to meet with teachers, to one, get consultation in there, collaboration time. What are you seeing in the classroom? Because when you're writing your progress reports and you're showing that there is generalization of skills, how are you showing that? Having that collaboration time, building that into your week, building into your service delivery is critical.
Absolutely.
You mean talk about top of your license?
Yes, I love it. I can't wait.
Okay.
Wait. I do have someone that says you can't do that if you have a caseload of 80.
Mm-hmm.
Okay.
That's what I was fixing to say.
Yeah.
Because, okay, working at the top of your license, and this is an advocacy piece not only for yourself, but for your students. We, as speech language pathologists in the schools, we're considered the jack of all trades. Here, do that, run here, whatever. Okay, so we have got to look from the student's perspective as well as our perspective. There are things that are within our workload that are not at the top of our license. And you guys, I'm speaking to the choir. But here's the deal. Do I need to spend my time making copies and mailing out copies of an ARD? In other states, it's an IEP. Do I need to do all the documentation, entering of documentation? When some of the jobs that we do are secretarial, and advocating for support for some of the secretarial part of our jobs. And I know it's not easy. But it's very critical that we are intervening, collaborating, consulting. Is it important that I run the stamp machine through so that I can send home the progress reports? Is it important that I put in everybody's box the progress report? We've got to start advocating for some of those things that can be done by someone that is not a master degree professional licensed medical provider to do some of those things. And part of that is, I will tell you, one of sometimes I do not get administrative buy-in. That is absolutely the truth. You guys understand that. But you've got those friends in the school setting that might have a paraprofessional that you could say, hey, I need these things completed, and I'll be able to collaborate with you for those 30 minutes if she could stuff the envelopes. So thinking outside the box so that you are not doing some of those things that are not the top of your license. You need to be intervening. You need to be collaborating. You need to be creating goals, for goodness sake. You need to be doing all that work that is the top of your license and start looking for ways that you can delegate some of those things within the school setting to allow you to have more time. 80 is ridiculous. It's not even doable. I understand that, but I also understand sometimes you're in that position. We're in Texas, Carolina, and we're a non-union state. So who's going to fight for us? We are. But remember, you're not just fighting for yourself. You're fighting for evidence-based, appropriate services for our students. And if we go at it from that, who's going to argue with you? You know, if it's about the student, we've got to start reframing how we put things. For the best delivery for my students, I need secretarial support. I need some support so that I can work at the top of my license doing the things I've trained to do to support the students.
Right.
That a lot.
Yeah, but no, you touched on something, and another word that I heard beside, I love top of the license. I love that. But I love the other part of that is skill delegation of skills. And you hit right on that. And that was another thing I was just looking, and I thought, yes, there's a lot of skills that are not specialty skills that we need to be doing. And I think another problem, not problem, but you know, speech paths, we are amazing, and we can do it, and we kind of all have that feeling like if we want it done, we want to do it ourselves because we want it done right. As my sister says, why wouldn't you do it my way? Why would you do it wrong? You know, and I think some of that we have to it's the control. We have some of that control that I think we need to let go of. You said, you know, if we look at it, yeah, we need to have the authority to be able to advocate for ourselves, because what we're doing is federally funded and it's the law of what we need to be doing. And some of the other stuff is not what we should be doing. And then definitely kind of letting go of some of that control, which I think it's hard for me, very hard for me. And I think it's hard for others to just let go of some of that control and rely on the other staff. Building those relationships in the schools that you're in. I know it's hard for a speech path that has got multiple schools to build those relationships, but I think that that's super important to build those relationships so you do know who you can go to be helping you with some of the things that really are bogging down your workload.
There was a good question asked. The person didn't put their name, so I'm just going to share this. Basically, the question is, our scope is so large, we're being pulled into behavior and behavior intervention, and oh, they've got behavior, they're cussing, they go to speech. I see that all the time, every week. And what that requires, I think, of us, and this is a team thing, and it's a big buzzword right now, but that interprofessional, multidisciplinary decision making has got to change within our schools. And we're probably going to have to be the leaders because we are the communicators. But looking at, not just because you cuss and you have some behaviors, is that necessarily, do I understand it? Could I do it? Absolutely. Do I have the time to do it? Probably not. Are there other individuals within the school setting that could support that do not have, you know, you guys know this, we do all the intervention. We are case managers. We are assessors. We are school psychs, educational diagnosticians, speech language pathologists, and sometimes occupational therapists if there's not one there, because we're going to support that. You know, we put on all the hats. But we're doing it. We're putting on all the hats. Is there someone else? Remember, we're going to work at the top of our license. Our piece is pragmatics. Could we educate a paraprofessional to provide some of those services? Could we engage the parent to do some YouTube examples to work on social stories? Absolutely. Could we engage the school counselor to help support that and do a lunch bunch? One of the things that I've seen was one of the best decisions an SLP did in the Austin area is she implemented, are you ready for this? The sponsor for the National Honor Society and students to work on appropriate social skills at lunch with a lunch bunch. And so that was part of the indirect services at the top of her license. The speech pathologist trained the students, trained the National Honor Society, who actually I think taught science or something crazy, But she was that sponsor to how do we implement support into community involvement, school involvement for those students that struggle with behavior and pragmatics. But our piece was the pragmatics. We talk about, we don't say things like, you nasty whatever kind of person. But we tapped into those other support systems. And I know in the beginning it's hard because you've got to do the training piece. But once you get it set, we're there in year 4 of this activity, and the outcomes are extraordinary because you know who supports kids? Their peers.
Sure.
They don't care what the speech lady says. But when their peers say, don't say that, that's rude. It's amazing what can happen. And I got to train the students to do that appropriately and in a kind and loving way. But they are the implementers.
I love that positive peer pressure, if you will.
Yeah, positive peer pressure, because that's how the world works. And remember, we're working for community involvement employment. If a peer says to you, don't take the last piece of cake before you ask somebody if they need one, that's a prag, right? So people that sometimes perceive behavior as within our scope, yes, it is, but there may be somebody else that could really address that a whole lot easier and better and actually have the time to do that.
I think I think that we need to train that we are there for the students that don't understand, aren't picking up, not that if they know it and they're choosing not to do it, we're still being pulled in with those sometimes.
Absolutely. All the time. Because nobody knows what to do, right?
Right. But but we should be, if they know it, they know what to do, but they're not doing it, then we need to be getting another professional, somebody else. Kind of I love the word transdisciplinary. Bringing it in, everybody in with scientific clinicians, like we're scientific clinicians, our OTs, but the non-scientific, the teachers, the paras, and all of that doing that. Cynthia said, great ideas, Lisa. Good. Really huge impact with the students, faculties, and teachers. I love that. Thanks for adding that to that.
Well, it's one of those things that I think we are empathetic, caring individuals as a profession. Mm-hmm. And I don't want to stop that because I can tell you, I get on every dang thing. But there comes a point when we have got to say, and we're at that point, we're in a workforce crunch across the nation. We are in trouble in our profession. And we have got to start, we as in a collaborative, we as in and advocating at the school level, at the administration level, at the national level, to say, you have got to allow us to move to the top of our license and use other resources. There's a workforce issue with teachers as well, but there are other individuals within the school setting that can support some of these things. And you guys, you're going to think I'm crazy, but it's amazing what a coach or an athletic director, some of those, like you're saying, our transdisciplinary people can impact these students so much more than we can in the moment situation. Those individuals that these kids already respect and are part of, pull those people in. I can't tell you how many coaches I have talked to and said, could you support when that student behavior starts to escalate, watch for it, 1, and 2, intervene. And then we get past all that baloney-rony that they're seeing, and they start having those generalization of skills. So thinking outside that box so that you are bringing in the whole team that cares about that student for that student's benefit.
Right. It's not something that just happens in the speech room. I think we have to get past
that. We know that research it doesn't support that.
No.
It really supports pushing out and getting into all those environments, in the cafeteria, on the sports field, all those kind of things. So we see a real impact, which goes back to my talking about, thinking about when you're 3, employability. If you can get it, and we are the data queens of the world. If the behavior is only in 2 places, what is the fallout? At the top of our license, I don't want to do a functional behavioral assessment any more than anybody else does, but we keep the data. And so we can say, look, on the football field, never a problem. Why? Why is that different? Is it peer pressure? Is it rapport with the coach? What is it? How can we benefit that? And we can help do that analysis because we are good at that. And we can say, okay, let's look at this. In the classroom, how about we make it a team environment? Is it a situation where we're very much siloed? Are we siloing for this kid? In science, this is the expectation. In math, this is the expectation. But this kid benefits. So when you're in that IEP meeting and we're talking about accommodations or we're talking about supports, maybe we need to look at just a different delivery system and helping our educators understand this. This is what's working for this kid. That's the top of our license. Not pulling them out and working on it in our little, office of where we work, is not going to benefit that student like it would be working with that coach, working with that math teacher, maybe explaining expectations and how that affects their pragmatics. They don't have a skill to not cuss at you. But if you give them a choice, just some of that training that we are just so good at that we really can impact behavior, but we see them 40 minutes a week. Are we going to impact behavior? No. But the classroom teacher will. The coach will. So using our team members.
Love it. Love it. When I think we were talking, we're really talking about our scope of practice when we're talking about, what we should be doing. And you were talking about the, scope of competence as well. And then I also liked when you were talking about evidence-based practice, putting that all together. Do you want to talk a little bit more about, we're needing to do evidence-based practices?
Sure. That old adage of we do it like this because that's how we always did it is no longer appropriate. That is not evidence-based practice. And we have gone through what we call audits in the state of Texas, where Texas comes in and looks at how come everybody has 30 minutes 2 times a week pull out. That didn't make any good sense. And I think part of this from our perspective is an educational piece. A lot of times we just take it. And I think as sometimes we're the most educated person in the room. That really is the truth. I think maybe that sounds tacky. I don't care. Sometimes we are. And being able to say, look, literally, evidence-based practice research tells us that we're not going to make a supported generalization of skills unless we get out there into the school community or at pep rallies, for goodness sake. Going to a pep rally, being part of that process, that's where we make gains. Yes, there is an educational piece, but there is a practice piece. And I think we look at that from the top of our license. Okay, this student right now needs my pull out for the education of how to produce a sound, how to take small bites, how to interact appropriately and take a 10-minute thought break before speaking. All those, there is an education piece, but there is an implementation piece that we do not flat have the time to do it, but we need to pull in that interprofessional thought processes because you guys, teachers, have great ideas. I've learned so much from teachers, and sometimes they're already doing some of this. We honor it, but we hone it. We hone it for our teachers so that we can say, look, yes, we gave the education of, going back to your question about picking up these behavior kids. We understand that there's a behavior kid. So here are some strategies you could use. How about adding some visuals? All those things we know. Setting up a schedule in the classroom. Preparing a kid for changes in the routine. Doing that education and walking out the door, because we're not going to be there 5 hours during the day, every day, but they are. And so that's what tells us evidence-based, that's evidence-based practice supporting generalization of skills. And that's the ultimate goal. That's the ultimate goal. Can they use it in their home, in their community, at their church, in the school?
And I think what I got you to say, and I'm excited about that, is when we're looking at evidence-based. So we have the client perspective, right? The clinician's expertise and competence. And now you're talking about evidence. And I think we get stuck on external evidence of, well, this is what the research says. Yes, that's great. But what about internal evidence? What is the measured response that you're getting of your interventions? And thinking outside the box. Maybe we aren't doing something traditional or the way they used to always do it. But if we're able to show that there is measured through our data, that there is progress being made, I mean, that is evidence-based practice right there. When you are showing your data, when your data is showing that progress is being made, maybe not the traditional, yes, twice a week, 25 minutes, once a week, 50, whatever, well, this is how all the goals were written. This is how they came to me. Well, we need to start looking at that and thinking, what's best for this child?
Well, and I think we've got to change our mindset. I think we've got to have a paradigm shift. That's one of those fancy words.
Okay.
Is that informal data is as valuable or more valuable than formal data. So being able to give a test and show a kid made 2 points gain or some craziness like that doesn't have near the same value as the parent reporting that at home this child has reduced the fight with their sister, has demonstrated some skills that were taught and practiced in the school setting to the home environment. The classroom teacher, and y'all, attendance is an informal piece. Those kids that hate school, but all of a sudden they're attending more because they have some strategies to use, is a very strong data point. Behavioral reduction, referrals to the principal, DAEP placements, IEP, all those kind of things are as important informal data as is a test that somebody gives in a one-day test in a one-day environment. And we are really good at taking that information as long as we have time to do it. Remember, top of your license. But taking that information, and that's evidence-based practice, that we can show that the goals we set forth are making gains based on, yeah, maybe there's a formalized assessment you gave a self, and that kid was then able to do some of the grammatical stuff. But what's going to make a difference is on some of that, even some other formalized kits. There's supposed to be benchmark testing in classrooms all the time. The kid uses, maybe they're not at the level of their peers, but suddenly they're able to add some descriptive words, some adjectives in their sentences. Holy cow, that's fabulous. That's great. But we don't look at all that. We just kind of go, well, we're working on this little piece of the puzzle. What we see is that generalization. I think that's critical, and showing our value and that we're providing evidence-based practice because of that generalization of skills to their everyday life. Functional performance is as important as academic performance.
And I think I liked what you said about even if it is a small step, that is still progress. And I
Absolutely.
think we aren't celebrating these smaller steps that we should be celebrating and showing. I think sometimes it is, parents have maybe an expectation that boom, speech, we're going to get them in and it's all going to change. It's all going to, everything else is going to go away. And to kind of slow walk them to the epiphany that this small step is leading them to here, but they're getting closer to it, bridging that gap of where they need to be. I think celebrating even those little small steps. I try to do that in my practice. I'm feeding, swallowing. And so I have to talk about just even a teeny tiny change in is huge because they weren't doing that yesterday.
Well, you guys know this. We have students that we support that are what some schools call life skills kids that are very impacted. And our goal may be that they turn their head toward a sound, right? We celebrate those things. Our evidence practice is, okay, talking about less cueing. The classroom teacher can say, I had to remind him every single day to come with a pencil. And he's come with a pencil 2 days this week. Y'all, that's a hallelujah moment. And we've also got to do some education for our administrators and our lead teachers and that kind of thing, that there will be behavioral deficits if there are pragmatic deficits, but also kids that have disabilities can act bad. They can be stinker pots just like everybody else. And we have to recognize that sometimes kids choose to be bad for other reasons. And it's not a language, all behaviors language. I know y'all have heard that. All behavior, it's language. Yeah. But is it because the teacher's boring? Is that something I'm sorry, is that something we can fix as speech language pathologists? Absolutely not. Is it because that they are in need of positive reinforcement? Is that something speech can do? No, that's the top of your license again. Training those educators, those administrators to understand not everything is pragmatic language. And truthfully, not all behavior that's presented by some of our students with disability, sometimes they're being a stinker. They're a kid. They're going to make mistakes. And we've got to be able to put up our hand and say, no, wait a minute. This, although behavior is in my scope of practice, is this behavior language related? And
right.
being able to talk that talk and get the right implementer to support those behaviors. And it may be a behavior coach. It may be the school side. It may be the coach. So knowing that information and advocating for our students and for ourselves, I think is something that maybe we've been lacking for a long period of time. And you know what it all goes back to? Education for other educators.
Right. That's the dynamic roles. Not only our dynamic role, but we need to bring in and get them on board and realize that they're part of this as well. At the beginning you were talking about, speech is not I can't remember what you said, but it was basically that we fix it all.
Jack of all trades, we do it all. Speech will take care of it.
Yeah, that's what you said. Speech will take care of it. I'm sure a lot of you out there get that every day. Oh, let's get them in under speech. Let's get them speech. That gateway, let's get them in as long as they've got speech. And we do need to advocate for ourselves. No, not just for ourselves, but for our students to say, right, there's something more. There's something else here. And I think we need to be able to do that. We need to have that confidence and say, there's more here than that. And
I think that honors our co-workers. That honors our teachers, because I don't know what it is about the school setting, but there's lots of blame gaming going on in the school settings, and we're supposed to be a cohesive group to provide services for these students. Your fault, your fault, your fault. Honoring those teachers that yes, these behaviors are extreme, and yes, they are difficult. Let's work together as a team and bring in this person and this person and this person, and let's impact this student for student success. Sending, putting out a referral for speech services, is that going to be the best support for that student? No. But it's a conversation. So going back to that, indirect services, you're going to collaborate, consult, and support that student by bringing a whole team together. And that really, y'all, that's the medical field. We do it all the time, but we've got to give ourselves credit for it. There's all those people that, there's the respiratory therapist and the speech pathologist and the occupational therapist and the nurse practitioner. All those people are coming together and meeting. We don't allow ourselves that time in the schools, and we've got to change that practice. We can't be super speech girl. We can't, because also it's not evidence-based practice. We're not impacting in our short little pull-out time. Nobody can get everything done in 40 minutes, 2 times a week or whatever. So.
Right. And yeah, they might be able to do it in your speech room, but if they're not doing it out generalizing, as you said, what are we doing?
Well, and I know that you guys hear it when you go to IEP meetings and you're like, no, they're able to correct. Here's all, I'm saying they're at 80% mastery level, or they're at 85% mastery level. And the teacher is, I can't hear a word he says. I don't even know what he's saying. Okay. Well, that's a problem for us, but specifically for the student. We're not maintaining generalization of skill. That sure isn't evidence-based practice, because our data says we have none. If the classroom teacher and they're a reliable source, that's also important. They're a reliable source. So we may need to reach out to the coach, to the cafeteria worker that talks to that child every single morning. What are you seeing? And we've got to get those services in other environments. So knowing all that information, it's not all us. It doesn't have to be all us. We're taking everything on.
Oh yeah, we do.
Yeah, reach out to your coworkers. Reach out to people that could impact even more than you can. Yes, you can do the education piece, and you can support some of that pushing out into the generalization. But we got to use our other team members.
That's right. Definitely. Wow. I think we're talking about, again, the dynamic role. I think you're hitting it, that we need to use all of the resources we have out there. And that's everybody on the campus. I love the fact you're talking about the coach. Maybe it's the choir director that has the
Sure.
best relationship. I mean,
Band director.
yeah, just
Yeah.
right. Yes. There's so many other people out there that can really impact a student, and getting them on board is wonderful. I love it. And Carrie is saying, thank you, very helpful and insightful, Lisa. I love that. Thank you for sharing all of that. I love that. This is really, Lisa, this has been fantastic. I know it's super fun, and you have been a great guest. I have really enjoyed your wealth of knowledge and experience that you're willing to share today. And when we're looking at, I think the one thing that we kind of touched on, and when I think about all the things that you've done and all the mentoring you've done, I think, maybe we shouldn't leave before we talk about, how do we find that mentor? How do we find mentors out there to help?
Well, I will say, ASHA does have a mentoring program, several mentoring programs. Like there's a leadership mentoring program that you can reach out and ask for help there. You're paying those dues, so use them. There are mentors for in every SIG group. They're in SIG 16, there are mentors that will help, like how to address needs at the administrative level. I mean, there's mentors so much out there for it. But also, you've been at this. I'm giving you my email. You send me an email, and I know Karen will do it too. Find those people that you've listened to and you think, okay, I like that. I want to ask some more questions. Ask the questions. We are ethically bound as providers to bring up the next generation. It's part of our ethics. And having someone that you can, and it's okay if you say, I don't know. I don't know. We're learning more about interprofessional education. Even sending someone a school psych. If you've got a kid with mental health difficulties, you reach out to your school psych and they can mentor you through some of that information. So knowing who to reach out to, and to know it's okay to reach out. We don't have to know everything.
Knowing what we don't know,
It's as important as what we know.
absolutely knowing what we
Absolutely.
know, and and really building those relationships and asking who to ask is so important. I find that going onto campuses, that sometimes I just need to sit in this, if I'm going onto a campus and I'm talking to another speech path, I need to kind of just sit in their space. And because sometimes they're saying something, and I would say, a speech path on a campus, a teacher might be saying something, or a parent might be saying something, and we're quick to want to answer it or something. But I think if we can sit in the space and really, really figure out, what are they really asking? What is really the issue with the child? Again, why is it the teacher can't understand the child? Why?
Mm-hmm.
What is different in the classroom than it is in the speech room? What happens? Is there an anxiety piece that they're comfortable with you in a small setting, and then once they're in a classroom setting, that just breaks down. So now we need to realize that, recognize that, and reach out to more supports. The supports are out there. We just need to be the advocates for the students.
Well, we are really, really good at active listening. That's our role. The one thing I see as I've trained students through the years is we're not really good at silence. We're fixers. And sometimes the person needs to vent, needs to have someone that empathizes with them, but you learn the best when you come to the solution yourself. And so allowing that's what we talk about a lot with, interprofessional education, is coming to yourself is where you learn. Someone telling you how to do it, you guys know this. Someone tells you how to do it, you're like, oh, and sometimes I do want to say, just do it for me. But that's not how we learn. We learn by making mistakes. We learn by coming to a conclusion with all the data together. And that's hard for speech pathologists to shut your mouth and let the person kind of talk it through themselves to get there. Maybe do a little guidance, but that's how we learn, is coming to our own decisions or our own ideas. So
right. And also sometimes we might even misunderstand what the question really was. So this is something I'm really working on for me, because I come from a place of yes, more specifically, oh, heck yeah. And I want to jump in and I want to fix it because I want to be, and then
Right.
sometimes so I am working on when I am asked a question, and this is so hard for me to do. When I'm asked a question, I need to pause. And instead of answering the question, I need to ask another question. And that is one of the hardest things that I am working on. But I'm really trying to do this to better my own skill set, is to really, so that I do understand exactly what they're asking. So I know I can help better, or I can figure out that, wait, that's not really what I'm doing here,
Yeah. And that's one of the things. It's funny that you say that, because I've got in my brain this thing, three before me. So I'm not saying anything till they've walked it through. They've come up with some of the solutions, and maybe they've even reached out to somebody else, or they've asked a peer, because you learn best by your own learning, or by teaching. By teaching is how you learn. And so I think we as a profession jump in and try to fix things, because that's our nature first, without really bringing those along and letting them kind of come to their own conclusions and even make some mistakes and learn from them. That's okay. That's how you learn.
I think a lot of us are afraid to make a mistake, or we're afraid because we're, to have to come back and say, ooh, maybe that wasn't quite right. Or, oh, wow, I'm sorry. Let's try this another way. Or, wow, I was hasty on that. Yeah.
And that's an okay thing to say. You know how much medical error there is in the world? Those are the top of their license, all the medical errors that happen, because it is a learning process. And we can't open up that kid's brain and look inside and see why they're acting the way they are, but we could just support it and make a change and shift and do something else. So absolutely. You guys, I put my email in the chat. I am honestly happy to answer any questions. Please email me. I would love to support you through some of this, guide you through some of it. Or if you just want to complain and go, you've lost your mind, I have 80 kids on my caseload, how am I going to do one more dang thing? I got you. Because in my family, like we say, do you need me to find you a solution, listen, or cuss along with you? Those are our choices.
Oh, I love it. I love it. I seriously,
we're sometimes you just need a head to listen to you that gets it.
Absolutely. I love it. I want to just thank you so much for being with us today. I want to thank everybody else who's listening. This has been so exciting. Lisa, I want to just thank you again. Thank you for sharing your email. I love this.
So if you didn't get a question asked, or you think of something, I'm the queen of when something's over, dang, I meant to ask that. You have the opportunity now. Send an email to Carolyn, send an email to me, because also Carolyn is going to do some more of these podcasts. Don't miss them. They're going to be good. There's going to be all kinds of interesting information, but it's another opportunity for you to reach out to her and ask any questions. I'm more than happy to answer any questions, or let you in, or cuss, or whatever you need to do. We'll just try to work through some of these issues, because we do a hard job. And I think that respect is not always there, but let me tell everybody that's on this podcast, I respect you. I know how difficult your job is, and you're making a difference for your students, period. You're making a difference.
All right. I think that's all we have to do today. Oh, wait a minute. Hey, Lisa, I'm so sorry. We did get something else in.
Okay.
I'm trying to understand how far our scope of practice goes. What are the boundaries that we need to establish for cases involving, I think we did the student behavior.
Yeah, we talked about that.
You know what? I must have missed it and you answered it. I'm sorry. We're good.
Yeah,
we're good.
But also remember that the scope of practice is not your scope of competency. So if you are not comfortable with behavior, you say so, or you get some more information, and it's perfectly appropriate to say that is not within my scope of competency.
Perfect. All right. Thank you so much. Bye.
Bye, Carolyn.
Thank you. Bye. Thanks for joining us on today's podcast. Remember to go to speechtherapypd.com to learn more about earning ASHA CEUs. We appreciate your positive reviews and support, and would love for you to write a quick review and subscribe. If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete address in your account profile prior to the course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to be reflected on your ASHA transcript. For our School of Speech listeners, we have a special coupon code to receive $20 off any annual subscription to speechtherapypd.com. Head over there to get ASHA CEUs for listening to this podcast and all other episodes. The code is SCHOOL20. That is SCHOOL20. Hope to see you on our next episode. Also, please don't hesitate to tell us which topics you would like us to cover in future episodes. To get in touch, drop us a line in the comment section or send us a message on social media.